And then he said something super unexpected. Since inception,
Yeah.
he has been telling CMS to pay Medicare Advantage plans less. He said, pay us less.
He's saying what we're all thinking.
What would we sacrifice if we wanted a better healthcare system? Oncologists need to give up being paid more for prescribing more expensive drugs.
The commonality is, hey, I'm going to get a discount here, I'm going to keep it, and I'm going to overcharge you. He basically reads the first chapter of the book and then argues how the book ends.
Hello and welcome to Debunked, where we discuss healthcare news with a bit of pizzazz. So this episode is going to be heavy on what some high-profile people have said, and there will be some real-time debunking. So let's get started. So first, I got Ed Park to make some news at the Medicareans conference in Las Vegas in sort of late April. So, Ed, of course, is the CEO of Devoted Health, which has been on a growth tier. It's a Medicare Advantage plan. They now have 500,000, so 500,000 members. They're in 29 states. And Medicareans is interesting because it's a conference that brings together like brokers and agents and field marketing organizations. And essentially, if you're selling to seniors, whether it's healthcare insurance products or financial products, you got to be there. And Ed was very interesting because he said very clearly in the fireside chat that I moderated that he has only come to this conference and he doesn't want to go to any other conference this entire year. Okay, so fine. There were plenty of people that were fans of that comment. He had a lot of applause and all of that. So he's on stage, he's talking very passionately about, taking care of seniors as if they were they were your own family members. So he's very focused on the whole person, very focused on the idea of prevention, and that if you take care of people early, in their 60s when they start coming into Medicare Advantage and Medicare, that you prevent downstream expensive care, as seniors age. So I was like, I've heard this story before. Every Medicare Advantage CEO that I have spoken to,
not rocket science.
They speak very, very passionately. No, it's not rocket science, but it's also, that many people have said. The uncomfortable truth about Medicare Advantage is that it costs a lot.
Yeah.
And so that's what I asked you. I'm like, look, you guys, talk a good game, but every year costs are going up. And MedPAC, the agency that reports to Congress about Medicare costs and outcomes, they reported that if the Medicare Advantage enrollees were enrolled in traditional Medicare, so fee-for-service Medicare, it would have cost us and the U.S. government $76 billion less. $76 billion. I mean, wow. We'd have more money to go into some other Middle Eastern country and do a little foreign skirmish, I guess, with that amount of money saved over. So I said, Ed, I have not heard an answer that I've liked from any Medicare Advantage plan CEO about costs. And then he said something super unexpected. He didn't talk about fraud or abuse, and waste, which is in the system.
Yeah.
He basically said that since inception, he has been telling CMS to pay Medicare Advantage plans less. He said, pay us less.
Wow.
There's, too much, we have $39 trillion debt. It's unsustainable, so pay us less. And I was like, man, he's creating headlines for me.
Wow.
I loved it. I was like, yes, you're writing, my own headlines. So, I was truly taken aback. It's a level of honesty that I've not really heard. And publicly too. There were hundreds of people in the room.
Yeah. Sounds like a Cubanism to me. No, but look, wow, what a gift, right? You should send him a basket. Nice
like a
little
gift
fruit
basket. Thanks
edible
for writing my headline.
Edible arrangements, something.
Yeah.
But look, he basically laid it out. It's pretty simple. It's not something that we all don't think about.
Yeah.
Right? Especially who are us that are sort of in the game, if you want to call it.
But for-profit plan CEOs saying pay us less.
But
I don't want to diminish that fact.
I'm not diminishing it. I'm just saying, but he's saying what we're all thinking, right?
Yes.
Like the background of what he's saying is, yeah, man, this stuff is expensive, and MA plans are raking it in. I mean, look at the earnings, look at the raises that they're doing, the rounds that they're raising. I mean, there's a reason why people are backing this stuff, because it's like, oh my God, right? Now, but here's what I sort of assessed, right? What he was sort of saying. Okay, we overpay for MA plans, right? Relative to traditional Medicare,
Yeah.
right? So maybe it is a reasonable target before you cut core benefits and raise taxes, that you sort of look at that overpayment, right? Is what he's sort of saying. Now, good old Eddie. Can I call him Eddie?
No, you can't call him Eddie. Poor
Why
guy.
not? I like to give people nicknames.
Oh,
Eddie sounds like a
we
good
know
nickname.
someone else who likes to give people nicknames.
I know,
You want
that's
that
why-
comparison?
No, that's fine. I'm playing along with what's happening in today's
Jeez.
right mind.
All right,
But
your
anyways,
point.
right? He is to your point, he's a for-profit CEO saying, pay me less. But you just said, MedPAC said the same thing. I mean, we are basically, there is a huge gap here. Medicare, regular Medicare would be less costly.
Yes, yes.
So he's sort of stating the gap,
Mm-hmm.
right? To be honest with you. Now, I think, could there, and he also mentioned, I think you mentioned, there could be some correction as long as you manage, right, inflation, metrics in there. And as long as there is not a degradation of the quality, right, and you're not sacrificing access.
Mm-hmm.
So, I mean, he's not saying something that's off. Now, if I'm an investor and devoted, I'm like, dude, what the heck are you saying? Right? Like, from an investor lens, you're like, man, this is not what I want to hear
Not
from
just
one of my for-profit CEOs.
Yeah, not
right?
just investors. I had people come up to me after the event.
Okay.
And
Yeah.
they said, like, I'm sure AHIP will not be happy about that.
Yeah,
AHIP,
the
of course, is the
PACs.
insurance lobby.
Yeah, they're not gonna
And
be
of course,
happy about
so we actually have to see. I mean, I applaud him for saying what he did, but we have to see whether the math and model scales.
Yes, but here's the thing too. I mean, this guy, Mr. Eddie, I gave him a Mr. now, okay? That's a very bullish statement to be like, all right, yeah, come on, you know what? Cut it. Because either he's so confident in his business that he's like, you know what, I'll still crush it.
Yeah.
And you know what? If the payment structure is readjusted, maybe somehow his competitors that are not as efficient as him get crushed, and that just adds to his market potential.
Yeah. No, it is
So
absolutely.
it's
you're
a wait and
absolutely
see
right.
game, to
Yeah.
your point.
Wait and see game, and you're absolutely right. It's either very foolhardy or supremely confident. For everyone's sake, I hope it's the latter, honestly.
And
'cause
maybe it's somewhere in between.
time will tell. Time will tell.
Yeah.
Okay. The really interesting thing is, this is something that I'm hearing about more and more, and it fits very well with a recent blog post by
Yeah.
Dr. Ezekiel Emanuel. Ed Park is talking about taking less payments, so in a way, he's sacrificing. And so Dr. Emmanuel wrote in his latest post, also worth reading. I'm going to put the links to the story that I
Yeah.
wrote about Ed Park and this blog post by Dr. Emmanuel in the description or in the comments of this video. And he's basically asking a simple question. He's saying, simple, but not so simple. What would you sacrifice? What would we, as
Yeah,
consumers, what would we sacrifice if we wanted a better healthcare system? Now, in our world, especially in mainstream consciousness, there are 2 or 3 giant culprits in this broken healthcare system where we are fighting high healthcare costs. You have pharma companies that charge enormous amounts of money for drugs. You have PBMs.
Yes!
Yes, I know, your favorite whipping boys. You have the PBMs. And then you have insurance companies that deny or delay and deny care.
Yeah,
So you have these 3 entities embedded in the mainstream consciousness. If you read Dr. Emmanuel's post, you'll see how there is not a single entity whose hand is clean. He talked about doctors and providers and how they drive up costs. And I just wanted to read a couple of those things that he said. What do they need to sacrifice? And he said, oncologists need to give up being paid more for prescribing more expensive drugs, which also increases their patients' copays. Today, they get a percentage of the price of the chemotherapy they prescribe. Oncologists should be paid a flat fee for administering chemotherapies, not unlike PBMs that get paid based on the list price of the drug, right? And then he said about hospitals, he said hospitals also need to give up charging more for the exact same MRI, surgical operations, and other interventions that are paid much less if done outside the hospital. That is the need to accept that the cost will be the same regardless of where, as specific medical service is provided, the so-called site-neutral payments. Remember that
we talked about it.
We talked about it. It was in a bill, I believe, and then it got axed again. Again, the individual lobbies are jostling to protect their interests. But I just loved how he enumerated, sentence by sentence, bullet point by bullet point, all the different entities. I want you to chime in on what you thought of the blog post.
I love it. I mean, he puts everybody on blast.
Mm-hmm, mm-hmm.
That's what you should do. I mean, he started with the common ones and my faves, PBMs.
Yes.
My faves, right? But I mean, but in seriousness, I mean, if you look at the hospital piece, like you obviously mentioned the site neutral things for like doing scans and stuff. But I mean, look, there's also this other thing that I sort of thought about, and then I went and did a little bit of research on. There's also monopoly level charging happening to private insurers. Okay, so when they basically, it's total highway robbery. I was like surprised at this. On average, they're charging the private insurers, once they use 340B programs, 246% of Medicare rates.
Mm-hmm.
So it's like same thing. It's the commonality is, hey, I'm gonna get a discount here, I'm gonna keep it, and I'm gonna overcharge you.
Right.
PBMs are doing this, oncologists are doing this,
Mm-hmm.
hospitals are doing the same thing. I mean, they're basically buying on discount, and then billing the private insurers on a higher rate than Medicare. So, I mean, that is massive. Right? And then you talked about this already, the site neutral part. And then the oncs, I was so shocked and surprised at that. I mean, that's basically PBM's playbook. Right? You're basically taking exactly what the PBMs are doing. I mean, it's basically showing that, everyone is to blame and we all have a part in this. Right? But here's the thing I'll also tell you. We all have a part of blame in this, every entity. But at the end of the day, too, do you blame them? I mean, how can you, like, here's the thing, right? And you don't know who came first, right? So did pharma start doing this? And then they're like, oh man, we need to do this because we're getting crushed. So if pharma is raising prices, I'm getting screwed. Well, how do I do my own screwing? I'm just saying, like, you just don't know who came first.
But
now
matter.
everybody's to blame.
To me, it doesn't matter who came first or last. Whether you were evil from the beginning or you became evil in reaction to someone being evil.
I'm not giving them I'm not excusing them. I'm just giving a explanation for that.
Yes, but I think what's really important is that he says everyone has to take a step back, and he said that about himself too. Right?
I mean, he's a doctor.
Yeah, and as a consumer, what would he like to give up?
And I'll talk about this in a second. And similarly, right? Like, look, why fee for service has been beaten up a lot in the past, right? And look, I've made it very abundantly clear. Like, I'm a fan of value-based, but I'm not sitting here saying that it's the holy grail, because I personally have seen companies, entities, practices practice volume-based and still have positive outcomes for their patients. So I'm not sitting there, I'm not the expert to sit there and say one's better than the other. Now, yes, let's talk about the list, right?
Of what he would like to give up.
I'm going to put on my fake invisible glasses here so I can see.
You're not that old. Come on. Increase the font size.
Yeah, exactly. Ritz-Carlton-like hospitals with exquisite art in public spaces, right? Amazing reception areas, fancy wood-paneled patient rooms.
So this is Dr. Emmanuel says he, as a consumer, would sacrifice this.
He's like, I'll take old couches, plastic chairs, kids scribble. He wants IKEA to basically design the hospital. There you go. Why not? I'd take it. Okay. He'd be fine with 10% fewer new drugs coming to market over the next 20 years if all new brand name drugs were priced based on their health benefits.
The outcomes-based stuff.
Okay.
Yep, makes sense.
Okay, so you're sort of crushing new innovation in the drug space.
But assuming that all those new innovations actually achieve something.
That's what I'm saying. I get it. I mean,
Yeah.
you know,
Which
I don't
we
know,
take as a given until proven wrong.
We do. And I mean, I don't even know the exact number, but it's definitely in the billions that it takes to get a new drug to
And
market.
so many drugs fail phase 3. I think this...
Hundreds and thousands of drugs.
Yeah, so this crushes your argument about crushing innovation. Moving on.
Sure. Okay. And he would accept wait times of, say, 10 weeks longer than today for elective hip and knee replacements, spinal fusions, disc repairs, cataract surgery, MRI scans, colonoscopy.
So elective stuff.
Elective stuff. And you know, the one thing I want to say here to him is, dude, are you getting in somewhere before 10 weeks? Like, is he like, he must be drinking something. Maybe he's drinking that colonoscopy drink, right? Because I'm sitting there going, dude, where are you getting in 10 weeks early? This stuff is already over 10 weeks.
I would agree with that.
So I'm not discounting what he's saying.
Yes.
But he's got his facts wrong. Okay. So I'm going to go to the next one.
Okay.
Okay. Lastly, he says, finally, he'd be willing to give up today's super low generic drug prices as long as the higher generic drug prices came with the requirement that the generics are produced in the United States and there won't be shortages. Wow.
I think this is quite revolutionary.
What a pro-US guy.
No, but and as it should be. What are people going to do?
Good for him.
So you're not being sarcastic.
I don't know. Am
He
I?
sounds sarcastic.
Maybe,
but
maybe not.
He's not. Okay. I mean, look, I think obviously some of these are maybe couched as pie in the sky sort of hopes, but I think it's a fair point. We don't need that many drugs. Many of them fail anyway, right? So I'm actually okay with that part. About generic drug prices, I mean, I'll have to see. Everything costs so much more. People like the fact that generics are low. But yeah, if it's tied to better, if we can clearly identify that it's tied to better benefits and it will be made in the US, I'm all for that.
Yeah, I mean, look, there's some argument there, but there's also some argument on price transparency and just, you know, forcing, like, you know, why, you know, most favored nations pricing, like all that stuff. So I think there's some middle ground there.
Yeah.
That's why my comment was like, not, you know, like I was like, I'm going to leave it up to you if you think I'm being sarcastic or not. The furniture thing and stuff, I like. I'm like, you know what? Like,
we don't need, you know, I mean, I think sometimes focus is on the wrong thing. I mean, I think the biggest question is prevention. And he didn't say a ton about prevention in the United States. And I think a lot of the costs would go down if we could focus on prevention. No one wants to pay for prevention.
100%.
So
100%. I mean, that's a payment reform thing that we've talked about in the past. We're a sick care system. We're not a preventative care system.
Yeah.
Right. And look, the couch thing and it's nice, but believe me, if you add it up, that's like the least of the problems. That's like the least of the cost.
True.
Nice furniture and stuff. Are you kidding? Like, you know, like there's bigger fish to fry.
There is bigger fish to fry. All right. So here was Dr. Emanuel debunking the notion that it's only the pharma companies and the PBMs and, you know, only a few entities that need to sacrifice. All of us need to. So I like that.
Yeah.
Another great debunking happened real time on television. Not that I was watching the whole 3 hours testimony or 4 hours.
You weren't on C-SPAN?
I was not on C-SPAN. But this is RFK Jr., our venerable Health and Human Services secretary, HHS secretary. He was up on the Hill, you know, answering questions from 2 Senate committees. And obviously the issue of vaccines came up.
Shocking.
So he got into it a couple of times with Bill Cassidy, who's a physician and senator. And so in one exchange, it was really interesting. Kennedy is citing 2 studies to basically say that, look, even before vaccines came along, you know, public health was pretty good. Mortality rates were declining. So he cites, and I'm going to read it out in full. All right. So if you look at the historical data, the biggest decline in mortality from infectious diseases occurred before the introduction of most vaccines. This is RFK testifying.
Sure.
And this is documented in the literature, particularly in the Geyer and the McKinley study. those studies show that the decline in mortality from infectious diseases was largely due to improvements in sanitation. It was due to improved nutrition, it was due to improved living conditions, and it was due to public health measures that had nothing to do with vaccines. Medical interventions, including vaccines, accounted for only a very small percentage of the overall decline in mortality. Those are peer-reviewed studies. They are widely cited in public health literature, and they show that the primary drivers of improved health outcomes were environmental and social factors, not vaccines. So Senator Cassidy was not going to let it go. Some time went by. I'm sure he had his staff sort of look up these two studies.
Yeah.
And then he comes armed with information and he says, earlier in the hearing, you referenced the Geyer and McKinley studies. So I went back and looked at those studies. They do show that sanitation and nutrition improved mortality before vaccines. That's true. But that is not the whole story, because those same studies also show that once vaccines were introduced, there was a dramatic decline in cases and deaths from vaccine preventable diseases. Let me give you an example, he says. Before the measles vaccine, there were approximately 3.5 million cases of measles per year in the United States and about 500 deaths annually. After the vaccine was introduced, that number dropped to fewer than 100 cases and essentially 0 deaths. So that is a tremendous impact of vaccination. Therefore, I think it is incorrect to use those studies to suggest that vaccines are ineffective, because the studies themselves show the opposite once vaccination begins. I mean, wow, and mic drop here. I mean, Senator Cassidy is not only a doctor, he's also a Republican. And I think these two clips should be played back to back as a PSA announcement to everyone on YouTube, TV, TikTok, wherever young parents are hanging out. I mean, you can't make this up. He's using a study to say exactly the opposite of what the study says.
Brilliant, I tell him.
Yeah.
I call him brilliant. I love this administration, don't you? There's so much good content. You guys should be like so excited as journalists, right? There's so much content. Oh, Bobby. Bobby. Can I call him Bobby?
Yes, Bobby. He's
Bobby's
known
okay?
as that. You can't
Bobby.
call him that.
Bobby. Bobby Uncle? Can I call
No.
him Bobby Uncle?
No.
Okay.
It's not that
All right.
old.
He basically reads the first chapter of the book and then argues how the book ends. So I like this one actually even better. He says, you know what? He's bragging that car accidents went down after seatbelts and better roads and traffic laws, but he ignores the fact that airbags had anything to do with it. I mean, you're basically going to take some information, leave out the other pertinent information, and make a claim. And I love how Cassidy did this. I mean, basically, he lets him hang himself, right? Like, he's the one who brought the studies up.
I know.
Cassidy didn't bring them up,
Yeah.
right?
But they're banking on the fact that
he
no one's
basically-
going to listen to a 3-hour thing,
And he's
right?
basically like, hey, listen, cool. You said clean toilets and water,
Yeah.
basically, right? And then he comes out and he basically tells him what happens with the and he didn't mic drop. He mic vaporized.
Mic vaporized.
Vaccine.
Yeah. Well, on that note, where we have public officials contradicting public officials, and brilliantly so, we'll come to the end of our May episode. And as usual, write to us at debunked@medcitynews.com and like and subscribe.